This is a KX News special report.
Good afternoon, North Dakota, and welcome to this afternoon's press briefing. Today, North Dakota Department of Health confirmed 42 additional cases of the novel coronavirus disease, or COVID-19, out of 1,813 tests. Dividing the 42 positives by the 1813, that gets you to the 2.3% daily rate. This is down from 3.8% over the past 2 days, and it's been our lowest single day positive rate since April 10th, which is great news because we want to see that positive rate trending down. It also lowers our cumulative since the very beginning, since the first case on March 11th, cumulative of the over 25,000 tests we've taken and 1,000 positive. That's a 4% positive rate. And again, we are, in terms of testing, with these tests at over 25,000 tests, breaking that threshold, North Dakota remains 6th in the nation out of the 50 states in Washington, the capital, Washington, D.C., so 6th out of 51. And again, we continue to ramp up our testing capability, but this is important, the amount of testing we're doing, because as I've said before, it's our gas pedal and our steering wheel as it guides us through these uncharted waters. If we go to the net case breakdown on the next slide, our total active confirmed are now at 577, and we've got 437 individuals that have recovered, and sadly 19 deaths. But again, in contrast, because our hearts go out to anyone who's lost someone during this time, who's passed away as one of the complicating factors being COVID. In contrast, we extend our hearts out to our neighbor to the east in Minnesota, who had 18 deaths today in the state. We've only had 19 during the whole journey, and of course their population is about 7.5 times larger than North Dakota, but they're at a much higher death rate than North Dakota. They're at 319 total deaths, right next door in Minnesota. So again, it helps remind us that this disease, it's not just something that's happening in New York or Italy or China. It can happen right next door. And again, thank you to all the North Dakotans who are doing great things to protect themselves and their loved ones. When we take a look at the current hospitalized, we're at 28. That's a new record as well. But again, this approximates between 1% and 2% of the total healthcare capacity that's available even in our current. That's before we get into any kind of surge capacity. And so again, super low utilization, among the lowest in the nation at any point in time during this in terms of the amount of people that we've, beds that have had to be dedicated towards hospitalization. So that's great. And again, we're very confident about the cumulative average response rate that we talked about because of the high testing that we're doing, and that 4% cumulative rate that we described on the previous slide. There's only 4 states that have a lower cumulative completed test rate than North Dakota. So this has been a great place to be during the pandemic. And of course, going forward as we move towards getting our economy going again, we're confident in the ability of North Dakota and our healthcare providers to serve and care for all of our citizens. If we take a look at the case trends slide, this is again above the line in the turquoise are the cases that are positive, and then the little light on the top of that is the new cases added on top of that. And so again, we saw that we had those 42 new cases today. But again, as we reporting these on a statewide basis, 36 out of those 42 new cases today came from a combination of Cass and Grand Forks County. We also had another nice day today too in terms of recovered. 28 people recovered, and so that's why you see the net increase, which went down yesterday by 10, up 14 today, so only 4 higher than we were a couple days ago. So bouncing around, too early to tell whether that's going to be the top of the active list or not right now, but we expect that we should see more recoveries in the days ahead. When we take a look at our continued decline in the positive rate, the 14-day cumulative rate on the next slide, we see again here that we're beginning to see a sustained decline. That, this is a pretty flat curve because we never had the steep uptake. As you can see, this is just the testing percentage for the last 14 days. Other states that really got into a surge condition, New York was New Jersey were in the mid 40% of tests taken were positive. Other states, Georgia and Michigan, were in the 20+% rate. So again, we're heading down in the right direction, but our curve was always quite flat because of, again, the great work that North Dakotans did to protect themselves and their loved ones. This is the lowest we've been at. Now we're at 5.8%. It's the lowest since we were back at 5.6 on April 20th, and it's down a half a percentage point, 6.3 where it was hovering for a portion of last week. Each day we show some different county slides. Today we're showing a rate of testing by county. This is the number of tests conducted per 1,000 individuals in the county. So statewide on an average, it's 33.5 tests per individual. You can see that where we did some of the very early on in one of our lowest populated counties, Slope County, it's in the dark green in the far southwest portion of the slide. That's the highest we have. We're a 170 plus out of 1,000. There's not even 1,000 people that live in Slope County, but a lot of testing per population there. And again, you can see in areas where we have had outbreaks and done concentrated testing, we've done more testing in Grand Forks and neighboring counties there, around there, as part of the rapid response testing we've done there in response to that. Also the same at Montreal and others. And again, you'll see the testing areas go dark because we're delivering testing capacity to places where we're observing outbreaks or potential outbreaks. On the next slide, we want to we want to jump into North Dakota Smart Restart again, which we talked about in detail yesterday. We released these guidelines, which is a roadmap to getting our economy going, a better, safer, healthier North Dakota for employees, employers, and customers alike. Lieutenant Governor Brent Sanford likes to call this COVID etiquette, and I think that's a great way to think about this because this is part of the new approach that we're going to have to take to make sure that we still have new tools and new capabilities to manage the virus and the pandemic. It's not going away, and it still represents a threat to individuals, especially those most vulnerable, but it also can represent a threat to businesses, as we've seen, whether you're in other states, food processing plants, or in our own state, where if businesses have to shut down because they have an outbreak, it represents a threat that way. And again, as we move towards releasing restrictions, the light touch that we've had on the 7% of jobs in North Dakota, again, reminding people that all of healthcare, all of agriculture, all of energy, all of construction, all of government, and all of education remained open. But for those that we're opening up, part of the North Dakota Smart Restart, there's guidelines for those industries. But we're also putting out these, which are the North Dakota Smart Restart includes standards for all industries, not just those that were covered under the executive order. So even if you're open this whole time, or if you mandatorily closed and you weren't under any executive orders, as you think about reopening, please check out the North Dakota Smart guidelines. They're available on ndresponse.gov, and then click down till you find the North Dakota Smart Restart. We're implementing the new standards in a new executive order. There were some questions about this yesterday. And on that new executive order, which we're pulling up next, is on 2020 VP3-06.4, meaning it's had revisions. These are the guidelines for businesses that are resuming operation or continuing to operate, and this requires that certain businesses sectors follow industry-specific standards. Reminder that all reopenings are voluntary. Yesterday, when we had Michelle Comer here, she talked about specific guidelines that were separate for massage therapists versus other personal care businesses versus bars versus restaurants. All of those guidelines are out there. In this executive order, it refers that businesses that were closed, as they reopen, they must follow those new standards. And there was a question yesterday about violations. And again, I want to be clear on that. Violations of the order would be considered an infraction. That's not a misdemeanor. It's an infraction subject to a $1,000 fine. And the local, county, or state law enforcement, whoever is appropriate, would be the ones enforcing that. But again, we're focused, as we were before, on the 98, 99% of North Dakotans who did a fantastic job of voluntarily complying to help protect themselves and those around them. And again, we expect that there will be high compliance because, again, high reliance on individual responsibility here in our state as part of the whole North Dakota SMART approach. But to clarify also, because there was questions yesterday, the state health officer, under the authority that's invested in that office, will work with local public health boards and implement measures that are necessary to spread communicable diseases. And those orders, which could be quarantine orders or isolation orders, those orders from the state health officer, different from the executive orders we're talking about here, those orders do carry the force of law and are often misdemeanors. So again, both infractions for executive orders, misdemeanors for state health officer orders, enforcement always local, but the main emphasis here is on the great voluntary responsibility, individual responsibility we've seen across the state. The order that we're issuing tomorrow is going to require that recreational and sports arenas, music and entertainment venues remain closed until further notice. We mentioned this yesterday, but again, that would include large concert venues like the Fargo Dome or the Bismarck Civic Center. It would include, when we say sports arenas, we're talking about places where at our college campuses, for example, where there might be sporting events. Those are all going to remain closed. Again, we're trying to avoid having the really large gatherings as we dial back up the amount of interaction and potential spread and potential risk, to dial that up in a slower way. We'll continue to work with the stakeholders, both public and private, of those venues on guidelines and appropriate timing for reopening as the pandemic continues to unfold. We've also had a lot of questions about schools and whether schools will continue with distance learning or return to in-person classroom. As I mentioned last night, we had a long discussion last night with Superintendent Baszler and Lieutenant Governor Brent Sanford and others. Today we had a discussion with some legislators, getting more input from legislators. Our office and DPI is also getting input from school administrators, the teachers union, and school board members, as well as parents, and we're continuing to work towards guidance that could be released. The earliest might be Friday of this week, but for right now, again, the folks should continue working on the distance learning, and let's make that as great as it can be, is what we, again, so keep trying to optimize that path for right now. We'll also, in the meeting last night, not just thinking about the school year, because education doesn't stop there. Many of our school districts offer summer programs, and so we're taking a look at preparing for what summer school might look like. We're also have this new concept called the fall, a pre-fall opening called an acceleration academy, which could put further distance between us and the coronavirus in terms of time, but it would also make sure that students that might have been falling behind have an opportunity to get accelerated heading into the fall year. So hopefully, as we say, through disruption comes innovation. We look forward to continuing to hear all the great ideas from K-12 leaders and teachers and others for how we can safely and appropriately use all of our assets to keep educating our youth. Long-term care update. As we've talked about before, we've got 8 criteria for a North Dakota Smart Restart. We've got checkbox by 7 of those. One that we don't relates to protections for the most vulnerable, one of the most important ones. Currently, we've got 27 long-term care facilities out of 218 that have been affected with a total of 130 positive cases. Of those 27 locations, 12 are staff cases only. 4 of those are resident cases only. And then we've got 11 others that are both staff and resident both. We do have rapid response testing teams that are working collaboratively with long-term care facilities to ensure proper protocols are being followed, and we're getting in and doing testing. When we have the first positive, we try to get in and want to test all the residents and all the staff, and that's going well, and we'll continue to expand that capability. Again, we know that there's in the news recently in Massachusetts, there was a veterans home. Over 70 people passed away in the same veterans home. This is obviously something that our entire leadership team in the state of North Dakota cares about deeply, that we want to make sure that we don't have that kind of an outbreak in any one of our congregate living facilities. So when we talk about vulnerable population protection plan, or the VP3, we're talking about long-term care, we're talking about skilled, we're talking about basic, we're talking about assisted living, and we're also talking about congregate homes that may be for developmentally disabled, the homeless, and others. I mean, these are all would fall under the vulnerable population category. So here to share an update on the important work that we're doing relative to the Vulnerable Population Protection Plan is Executive Director of the Department of Human Services, Chris Jones. Chris, thanks for being here today, and thanks for your leadership on this important issue.
Thank you, Governor. Just want to give an update on the VP3 plan. You can obviously see that it's one of the 8 that is not checked. So we're focused very intently on protecting our most vulnerable. And I just want to highlight what the Governor previously said. The vulnerable populations include all of those individuals in skilled nursing facilities and assisted living facilities, as well as those in group homes, those with developmental disabilities, as well as those in corrections, and also those experiencing homeless or domestic violence. Since last Tuesday, we've assembled a leadership team that includes Dr. Andrew Stahl, who is in the National Guard, but comes to us and has a great wealth of experience, as well as Roseanne Schmidt. Roseanne Schmidt was previously the interim administrator for a nursing home in Beulah and is a retired chief nursing officer from CHI St. Alexis, and Jan Camphouse, who is a retired CNO for Sanford Health. Their role is to garner the resources we currently have in the state to address this vulnerable population, as well as add additional resources to continue to build up and make sure that we are protecting our most vulnerable across all of these areas. And I want to stress that we're going to continue to move rapidly. This plan will continue to be enhanced day after day, week after week, and we are going to be pushing aggressively to make decisions as quickly as possible with everybody's interest in mind. So since last Thursday, we've been working closely with the hospitals and the nursing homes specifically as it relates to how will we move patients across the system. As the Governor has said multiple times, the capacity of our healthcare system, the acute care side, we have plenty of capacity, and we're ready for whatever surge comes. But given that, our nursing homes are operating at 74% occupancy, and a lot of that is also predicated on having adequate staff. So what we spent the last 3-4 days really working through with our partners is how do we have plans that either identify those nursing homes that can effectively quarantine those residents and cohort staff, meaning only have staff working with individuals who are COVID positive, or in cases where that can't be done, what is the transfer protocol? And the transfer protocol is not only to move patients from a hospital into a congregate housing setting, but also moving individuals from a congregate housing setting back into a hospital or another area. As a side note to that, we're in active negotiations to identify a basic care memory care unit, which would only be for basic care COVID positive residents. I think the important thing that we're trying to address here is that we do not have involuntary transfers or involuntary discharges of residents, meaning not only with this population but all populations. When an individual is leaving a skilled nursing facility or other congregate housing, we know exactly where they are and they have the protections available to them when they go to that next setting of care. And want to thank everybody over the last couple of days. We've had, I will be honest, we've had spirited discussion about how do we best serve this population, not only the COVID positive residents, but also the COVID negative residents. These aren't easy decisions. And this is why it's important that there isn't one math problem that we're trying to address. That's the role that Dr. Stahl, Roseanne, and Jan have as it relates to working with the community, with the assets, with the resources, developing the partnership, but making a decision very quickly when these cases come up. The other thing that the governor brought up is the rapid response teams. So we are standing these up right now to allow us to quickly deploy resources. It is being intertwined with the testing strategy that's ongoing specifically within skilled nursing today, but also have a direct line to these clinicians as it relates to having access to adequate PPE, having access to deep cleaning services, whether that's through the National Guard or through contracts that we are negotiating with cleaning vendors. And finally, as it relates to visitation policies, I want to stress that even though the governor is talking about opening up on Friday, that does not change visitation policies in any way, shape, or form. And I would encourage everybody who has a loved one in a congregate housing setting to limit visitation. Even if they can go in, please limit your visitation and use other ways to interact with your loved ones in these congregate housing settings. We are going to continue to look at this, but that is the way that we can protect the most vulnerable, by limiting visitation. And we understand that's difficult. We know there's a number of congregate housing settings that have set up FaceTime and Skype, and want to make sure that everybody has that. For those out there that don't have access to FaceTime or Skype with their loved ones, please work with that facility that they're in, and if you aren't getting what you need, please let us know and we will assist with that. But the number one way to prevent the spread within these congregate housing settings is to prevent or to limit visitation as much as possible. Finally, I want to talk a little bit about what's going on with the homelessness population. As many of you may not know, is we do have homeless within the state of North Dakota, and we do have shelters, but with shelters are congregate settings as well. And so they are at a higher risk for contracting COVID just by their daily living, and also by going into those congregate settings. So over the past few weeks in 8 communities, we've set up scattered housing for individuals who are COVID positive or need to be quarantined. And while doing that, we're also able to identify any physical or mental health concerns and have provided nursing supports to manage and monitor COVID symptoms. To date, we have sheltered more than 35 individuals who are COVID positive or needed to be quarantined, and we'll continue to be providing more information for this vulnerable population as we go forward. Thank you.
Thank you, Chris, and thank you to your team, and thanks for sticking around for Q&A afterwards. Also want to give a shout out too, because he says he's not a big birthday guy, but he's spending his birthday with us, so happy birthday, Chris Jones. Next, mail-in ballot topic. With the virus dominating the news in our daily lives, it's easy for other topics to fall by the wayside, end up on the back burner, but one thing we certainly do not want to ignore is one of the most sacred aspects of a democracy, and that's the right to vote. On March 26th, I signed an executive order enabling physical distancing while voting by suspending the requirement that counties have at least one physical polling location, and encourage counties to pursue the vote by mail plans for the June 9th primary. Well, some people may have seen that was early to do that. over a month ago. Ballots have to be prepared. There's absentee ballots that have to be sent out. And so we had to make a decision early. We didn't know what direction this was going to be going. We didn't know if we'd be open or closed. So in order to protect the right to vote, we took that early action. Heading into that, out of North Dakota's 53 counties, there were 33 of our 53 counties, and again, those were ones that were more primarily rural or very spread out, where they were already doing their election by mail, and that was the primary form in 33 counties. Under the prior law, they had to have at least one polling place. Usually that was at the county seat building, where a few people might trickle in on the day of the vote, but everybody, you didn't have to apply for an absentee ballot. Everybody was voting by mail, and so the vast majority was done by mail in those counties, and that's been going on for some time. So we know that voting by mail can work in North Dakota and can work in a way where we can protect the integrity of the vote and avoid any kind of voter fraud. We've worked with the tribal lands, county and tribal governments, and we've secured support for the vote by mail for all North Dakotans. And this means that in this primary, this has no determination on the fall election, but the primary coming up in June is that there'll be no polling locations open in the state of North Dakota for primary elections. All ballots will be issued through the mail. So again, while that may seem like a shocking thing to those of us that are used to perhaps going in and voting, I want everyone to understand we're still 6-7 weeks away from that election. There is ample time for everybody to get their voter by mail ballot, and there's a lot of help to help you make sure you can navigate this process. Starting last Friday, North Dakota Secretary of State's office began mailing applications for vote by mail ballots to every eligible voter in North Dakota. I know that I received my letter earlier this week. If you don't receive your letter, and it's a letter inviting you to apply for a ballot. So there's an action you have to take. You're not getting sent a ballot, you're getting sent a application for your vote by mail ballot. So if you don't receive yours by May 11th, and we'll make further announcements, please contact your county auditor or visit vote.nd.gov to create and print an application, which you can then send to your county auditor. Once you receive and fill out this application, if you've received yours in the mail, sign it and return it to your county auditor. After you've done that, they will send you the mail-in ballot. Completed ballots must be then returned by mail to your county auditor by June 8th or delivered to the county's secure ballot drop box by 4 p.m. on June 9th. Assistive voting devices will be available to any citizens needing assistance to complete their ballot. Contact your county auditor to make an appointment and learn about any precautions you may need to take. And voting by mail can be quick, easy, and safely done from home. We encourage all eligible North Dakotans to take advantage of this important opportunity that we have as Americans to participate in government. I want to say some thank yous. First of all, of course, to Secretary of State Al Jaeger, also to Attorney General Wayne Stenjum, all of our county commissioners, the county auditors, tribal leaders, North Dakota Association of Counties, North Dakota County Auditors Association, for their work in helping to ensure that every eligible North Dakotan voter is able to cast a ballot, and that we're able to do that while still protecting the health and safety of our voters, and even more importantly, the poll workers who volunteered, sat there all day, came in contact with hundreds of people, and they themselves might have fallen into that vulnerable category. So again, thanks to everybody making this happen. And again, the executive order we put out encouraged counties to do this, but again, it was counties that took the action to make sure that everybody has this right to vote and vote safely. So thank you to the counties. We also want to give another shout out. One of the things I know people, it's great to exercise the right of voting, and who doesn't love a sticker? And when you get to wear your I voted sticker, I mean, that's a cool thing. We had a contest this year, and I want to say thank you and congratulations to Chloe Brandon of Trail County. Chloe is a fourth grader, designed our next I voted sticker, and Chloe's design, which you can see on the screen and right here, was selected from hundreds of entries and will be used during North Dakota's 2020 election and beyond. And so many auditors are planning to include the sticker in the mailed ballots. So if you get sent a sticker, don't put it on until you've completed your ballot and sent it back in again. And when you've done that, then you've earned the right to wear the I voted sticker designed by Chloe. Congratulations, Chloe, and also thank you to the hundreds of other students, all those budding designers who submitted design. We appreciate that, appreciate you, and appreciate you supporting the great act of voting. Thank you. Okay, next up, we're going to do unemployment numbers. Straightforward, you get to hear these every day. Regular claims, 2336. Pandemic unemployment assistance, 519. Pandemic emergency unemployment claims, 644. Those numbers are all popping up again. Total regular claims since March 16th, again, 63,929, and then 9,023 and 9,738 respectively on those fronts. Next topic is Care 19, and Care 19 now searchable. Again, I said this yesterday, Google Play Store for Android users. And again, if you can we encourage you to do your part to help us slow the spread by downloading. Remember to enable location services in there. There's now 27,500 total users. That's about 4% of the North Dakota population. But of course, we need even the more we have, the more effective this will be. And again, your privacy is completely protected. So thank you if you're already a user either on iPhone or Android. Next up is our behavioral health update, and today's topic is suicide prevention for veterans. And supporting your and others' mental health is important, and learning about suicide prevention can make the difference in the life of you or someone you love. One of the tragic statistics that I learned after becoming governor, when we've got brave soldiers serving in the military, in the regular military, our North Dakota National Guardsmen have all been deployed continuously in the war on terrorism since the USS Cole. So that's before 9/11. We've had the longest continuous deployment of North Dakota Guard soldiers, and of course some of those who've bravely served in combat zones have given the ultimate sacrifice. But the statistic which is shattering is that over the course of the last 20 years, we've lost more North Dakota soldiers to suicide than we have to combat. And that's why it's important for us to think about suicide prevention and making a difference in the life of someone that you may love. North Dakota's Department of Veterans Affairs Commissioner Lonnie Wagon has issued a challenge to all North Dakotans to take the SAVE training or the SAVE training and become an advocate and a resource for those struggling with their mental health. The challenge only takes 2 steps in 25 minutes, and in that time you can equip yourself with the tools to get someone the help they need and maybe save a life. We've got up on the list here, the first step is a simple one. Add the crisis hotline contact information on this slide to your phone so you're prepared to help. And again, if this slide passes too quickly, 1-800-273-8255. There's even a selection after that. You can press 1 for veterans, or you can text 838-255 to chat, and that's again confidentially. And then there's also instant message to the veteranscrisisline.net or chat. That's step 1, is just make sure you've got those phone numbers handy and can get people in contact with them, or call yourself if you need to visit with someone. The second step from Lonnie is to register and take the 23-minute online training. Visit the Veterans Affairs website, nd.gov/veterans. Click on the Commissioner's Challenge in the top ribbon. The video that you'll see, the 23-minute online training, is designed to empower viewers with the basic knowledge of what signs may be for someone who is struggling with thoughts of suicide, provides ideas on how to help. And while the video does refer to veterans specifically, the principles are universal and everyone can benefit from the shared knowledge. We can all take the Commissioner's Challenge, and I challenge you to take the Commissioner's Challenge to prevent suicide. To learn more, to take the challenge, visit the North Dakota Department of Veteran Affairs website at nd.gov/veterans. In closing, for today's prepared portion, we want to say, again, our gratitude section. This goes out to Make-A-Wish North Dakota and the many medical providers, volunteers, and donors who for the last 35 years have granted 950 wishes to children battling critical illness. Perhaps most importantly, we want to recognize those children and their families whose strength, hope, and perseverance is an inspiration to us all. Today is World Wish Day in North Dakota, a day to celebrate hope and to recognize that many children and families are battling critical illnesses. During the ongoing COVID-19 emergency, Make-A-Wish has postponed most wishes to protect the health and safety of wish children who are already medically compromised, as well as the health and safety of volunteers and supporters. And while these incredible children wait for their wish to come true during this pandemic, Make-A-Wish is asking you to share a message of hope on your social media channel using the hashtags, hashtag wishes are waiting, and be sure to tag at Make-A-Wish-ND. And so that's our Make-A-Wish. That's kind of our good news, gratitude piece. And again, hope like gratitude grows when shared. And so thank you to Make-A-Wish for giving hope to all of these children. I also want to say, also as part of the gratitude section, I want to say thank you to all of our farmers and ranchers in North Dakota. We know that with the COVID crisis hitting a number of processing plants across America, that there's going to be, this is driving beef prices down. So if you've got a cow-calf operation in North Dakota, we know that you're facing tough times. As farmers are getting out, scratch a little bit dirt in the west, we know those that in the east are still facing very wet fields. We know that we've got folks, and we've been in contact with legislators from around James River Valley area. We know there's a lot of flooding that's still occurring locally there in some townships and covering roads. But again, we want those that are dealing with multiple challenges, whether it's economic or whether it's weather or whether it's spring flooding. They're dealing with that at the same time that we're dealing with the virus. We want to make sure that you know that we're thinking of you, and we continue to want to deploy resources to help support you as well. So thank you for everything you're doing to stay safe during these challenging times. In closing, I want to say a quote from Victor Hugo. Of course, he's the author that you know that wrote Les Miserables and also Hunchback of Notre Dame. But he said, in joined hands there is hope, in a clenched fist there is none. And again, we want to say thanks to all the people that are out there joining hands, but not literally joining hands because we're keeping physical distance, but they're doing that in a way where they're supporting their neighbors and helping people, whether it's someone who's got a flooding issue next door or whether it's a child with cancer. We know that every day there's remarkable things happening by North Dakotans, and we say thank you to all of you. And with that, we'll stand for questions. Okay. Okay, we've got some new news back on unemployment update. So this will pretend this was the first question. Can you please update us on what's happening with unemployment assistance? Last night, Job Service successfully implemented the software coding on our aging mainframe for the PUA program, made the initial payments of benefits to individuals today. There was 3,532 weeks of benefits were paid for a total of $2.5 million. These are to self-employed workers via the Pandemic Unemployment Insurance Assistance Program. This is a brand new program that was just created earlier this month by federal legislation, and there was no systems in the country to support this. So thanks again to our team that made all the changes, software changes to get this and make this possible. An additional 1,500 of these self-employed workers checks are going to be processed tonight for payment tomorrow. The remaining applications currently on file either require follow-up information or will be moved to a state unemployment insurance claim due to federal regulations. To speed the PUA benefits to individuals, the PUA minimum of $228 per week along with the $600 per FPUC payment was paid to each applicant for each week on their application, which includes the back weeks. As tax information can be processed, Job Service will recalculate each individual's weekly benefit benefit amount and will pay additional amounts owed to the individual at that time. This is consistent with the process used by other states that are striving to get as much needed payments into the hands of individuals as possible. And although any wait for benefits is frustrating, again, I want to say thank so much to our job service team member whose hard work appears to have made North Dakota one of the first 10 states to both accept and pay the PUA benefits. And again, with this new legislation, there wasn't any state in the nation that had software systems to be able to make these payments. So thanks for working around the clock, North Dakota Job Service. They've now handled more than 3 years worth of claims in just 6 weeks. And again, thanks to all those folks and everybody who's working on the hotlines. With now, we'll stand for questions. Go on, Jeremy, and then online.
Just a follow-up from yesterday, and perhaps I missed something here, but I believe you said there would be some more guidance for movie theaters looking to open on Friday. I'm wondering if you have that at this point.
I did include that. I had a slide up, and maybe you were doing double duty because I know they're having you do photography as well. Or maybe I actually passed over that in this thing, and I will, because I know we had a slide, and maybe I didn't say it. Did I pass over it, Mark? I did pass over it. I was so excited to get to the next topic. I'm looking for it right now, so I don't have to do it from memory, but I think I have most of it in my head. And where would that be? Anybody got a guess? Page 5 or right there, or you can read the slide, okay, which is, we worked with the movie theater, I don't want to say that they have an association, but owners of movie theaters, because even I was surprised a little bit when I saw the draft that said they were limited to 20% of normal operating capacity for each auditorium. But this is a place where they'd like to start. It allows for proper spacing, and it was explained to me that if you're going to close every other row, right away you're down to 50%. Then if you got 6 feet between people, I think they did the math and said if we're going to have every other row and 6 feet in between, you'll probably end up at about 20%. So they'll limit the sales on this in terms of that, and that'll essentially, the key thing here is allowing for proper spacing, waiting areas and things. They'll stagger start times, encourage timely arrival to eliminate congestion, implement new safety guidelines regarding food service. So I'm sure that you're going to see gloved and masked people serving popcorn, but I would say they're going to have some good rules, and again, it's all voluntary, but movie theaters can open up this Friday across the state of North Dakota if they choose to. And I would say if you're interested in going, go the first night on Friday night, because those theaters will be really clean. No one's been in them for a couple months. So, okay, thanks for catching that, Jeremy. I missed that when I went through there.
660 KUYZ in Williston. How long do you expect North Dakota to be in phase 1 of our restart, and what will you and your team be looking for to move on to phase 2?
For Mike, I don't have any expectations, because in this, dealing with something with this much uncertainty, having an expectation probably could either lead to making a decision with too much emotion, or could lead to disappointment. So again, we're just going to keep tracking the numbers. It's going to take us a while. When we have this, we talked about turning the dial, the dimmer switch up again, as we start to increase more interaction back into the economy, as the high contact businesses, I say, the personal care and the bars, restaurants, movie theaters, and gyms opening up, those high contact moments. The way the transmission occurs, if transmission is occurring as it did earlier in a gym setting in North Dakota at the very beginning of this, we may not know that for a week or two. So again, we have to, when you reset the dial, then you've got to go for a week or two at the new level to really understand whether or not you're seeing an increase in the numbers or not, and then seeing whether our commensurate capacity to deal with it is going up. So I guess I am setting a little bit of expectations, but given the 14-day kind of incubation cycle on this virus, I think it's very hard to move faster than the fastest you could possibly move is kind of 2-week cycles, because you would take that long to find out whether you're having a good result or bad result with the relaxation. And that's, again, I'd go back to appealing to individual responsibility. I know everybody universally wants things open. It's sort of an inverse. The more open you want it to be, the sooner, the more important that we keep practicing all the North Dakota smart hygiene and distancing guidelines. The better we perform, the sooner we can have our economy rolling again. Okay? Dave?
This is for Chris Jones.
Hey. Way to go, Dave. Thank you for. Here comes the birthday gentleman. I'm not going to ask how old you are, but I think you're past boy, right? You're the birthday man. No. Yeah.
You mentioned about people in assisted living centers and nursing homes. What about for people like visiting angels? Are there special things for people who visit people and give caregivers in-house, in the dwelling?
So just visiting, that's a home and community-based service. That they still need to follow the same precautions that we've had. There is a little bit of a difference there because those individuals are sitting in a single housing setting. They're in some ways socially isolated, which puts them at risk as well. So we do need to be able to continue to send workers out there, and those workers are following the PPE recommendations and the sanitation and those type of things. So that they are not impacted by this.
Required to wear masks or?
Yes. So they're wearing masks. Most of the home and community-based services, whether it be, I can't remember the firm you said, but they are visiting angels. They are making phone calls first to understand the situation before they go in, and then based on the screening questions they ask before that, that will then dictate what type of PPE they will bring with them. And oftentimes they will still bring their own, just out of an abundance of caution.
Chris. Wondering if so far, if anyone has been transferred under the new transfer protocols yet.
I'm doing a quick HIPAA law review in my head. Should be okay, right, Leslie? Yes, there has been. I'll just leave it at that. Yes, there has been.
And when it comes to those transfer protocols, is it more a question of the capabilities of the place they are in or the condition of the person?
It's all of the above, and it's even more. And so that's the reason we really want to have a partnership between the providers, whether that be a skilled nursing or other congregate housing setting, the hospital, the other nursing homes around there, if we're talking about a nursing home resident, and then understanding where that, if that nursing home can manage it, or that congregate housing can manage it, we need to be there and multiple times verify that they can manage it. We're not going to just trust that they can manage it. And then because there are other implications when you do transfer. So we are trying to take the rights of the individual in that congregate housing setting into consideration, as well as the rights of the other individuals who are living in that congregate setting, and weighing the risks of transfer against the ability to quarantine and cohort within that congregate housing setting. So there's not while we do have a very objective algorithm as it relates to transfers in and out, it still has to be a decision based on a one-on-one basis.
I have just a definition that I'd like to ask here. When you were talking about the homeless population, I think you mentioned scattered housing. I was just wondering if you could define that for us.
Scattered housing just means that we are putting them in, we are providing settings that allow them to be quarantined by themselves. So they could be multiple different types of situations. But we want to be able to isolate them, non-group. We want to.
Is that for everybody or just for?
For the COVID positives, because again, we don't want to put COVID positive individuals who are experiencing homelessness into a shelter and then have the entire shelter become infected.
Thanks, Chris. We'll go back online, and then Lane.
Eric Arndt, KZZY in Devils Lake. With North Dakota Smart Restart happening on Friday, what is the timeline for reopening Capitol Building and other state facilities for tours or business, as well as state historic sites?
Have no announcements to make on that today, Eric, but we do have a team called the Continuity of Government Team that meets 3 times a week that's reviewing all of this. Of course, we have tried to keep providing almost every aspect of government while we've been working remotely. And so again, like schools, there's right now no economic hardship associated with government buildings being closed. We want to provide those services and reduce the amount of transmissible contact time. And so that'll be one of the dials that we dial up, but right now no announcements on that yet. We're not I do know that some cities are thinking about reopening some limited capability next week, but that's not the plan for the state of North Dakota. We'll continue to do the remote working for the time being. Lane?
Governor, you've already said that there's not enough law enforcement in the state to post up at each and every business across the state. But if a business feels like they're being overwhelmed with so many people coming out this weekend, are they able to call law enforcement to come disband that, or does that fall onto the business?
Well, I think, again, this is I'm going to leave this to the good judgment of North Dakota business owners and local enforcement, because it's an absolute accuracy that we do not have the capability or probably even the interest to try to manage that at a state level. This has really got to be people using their own judgment. It can go from anywhere from someone deciding that they don't want to open. It's all voluntary if you want to open this weekend. If you do open and you find you've got a crowd that is exceeding the guidelines, then probably need to think about again, how you're protecting your employees and how you're protecting your business longer term, because it's not about, how many customers you can get on the first day. It's, how can you learn to operate under this situation in a way where you can sustain your business and not have an outbreak at your location. And the more people you have, the more crowded you get, you're increasing the possible transmission risk for your customers. And I would just think, again, good judgment would indicate that people would want to follow these guidelines to protect themselves, their team members, their customers. So and I think that'll happen. And like I said, in 99% of the cases, that'll happen. Will there be a news story or two about, beautiful weekend and some crowd that shows up one place? I'm sure there will be. I'm sure we'll be able to find that in a state our size, but that'll be far and away the exception, not the rule, because we just have a lot of people in our state that have great judgment. Jeremy, and then Dave.
This is a quick one. I just have a process question, I guess. You said that you'd like to stay away from doing another statewide closure order in the future, but you might do targeted orders for certain workplaces. Would those come from the state health officer, or would those come from you?
They would, if it has to do with quarantine, like it does with a plant closure or something like that, would be the state health officer.
Would there ever be like a mandatory closure order for an employer?
I don't know that there would be, because again, I think the incentive for employers is you can't run your business if you don't have employees. If employees are at risk, you want to protect them. And so in the cases so far, we've, whether it's large plants or small companies, the employers generally are right there saying, hey, let's close the place, let's clean it, let's do what we have to do, because they're trying to figure out that for the long term. And if I didn't cover this on the closures, I want to make sure I hit this one again, because there has been some discussion, but the executive order that we were talking about, which was 2020-06.3, that one is set to expire at midnight on Thursday night. The new one takes the 2020-06.4 takes effect at 12 a.m. So effectively they bump right up against each other with no gap. In the one that takes effect, it says that you can open your businesses using the guidelines at or after 8 a.m. on Friday morning. And I'm just saying this because I know we'd seen that there was some folks on Facebook that were planning to have big parties on Thursday night at midnight. I mean, we've got some cities that the bars are open till 2 a.m. And the intention of this is very explicitly says, we said May 1st, that means through this executive order, 8 a.m. on May 1st, not midnight on May 1st. We're not trying to be, we're not trying to set a North Dakota Smart Restart would not include midnight binge drinking before closing time. So we're trying to avoid that. I guess you can do that at home if you really want to do that on Thursday night. But we're at 8 a.m. on Friday morning. And for anybody whose birthday is May 1st, we're also thinking of them too by not opening till 8 a.m. If you're turning 21 on on May 1st, on Happy May Day. 8 a.m. is when you can start gearing up to reopen under the new guidelines. Other questions? We got Jeremy and then Dave. Or no, did I just do you? Okay, Dave, your turn.
Can I remember, you did issue an order closing state campgrounds, correct?
Yes.
Thinking about opening them up anytime soon.
Yeah, we're certainly thinking about that, and the team at Parks and Rec is, again, trying to figure out how do we do that and how do we do that safely. And I think, again, as we know in our North Dakota Parks and Rec, that's really in the summertime, it's a hospitality business. I think, over 100,000 visitor night stays. It's like running 13 hotels. We've got to make sure that whether the campground facilities, the public restrooms, that we got the right spacing, got the right hygiene. A lot of that depends on summer staff, and so we may think about this as a delayed summer opening or a spring opening, but I know that there is a desire, of course, if at all possible, we'd love to have them open before Memorial Day weekend, even if it's under restricted access, but or sooner than that. But anyway, those are some things that we're definitely looking at. And I just make a note to our team that we'll provide an update on campgrounds at a future state parks specifically. Cities, county campgrounds, will probably include some guidance for them as well, or they may be, a lot of people are so collaborative, they're just calling and saying, what are you doing? But we'll try to make sure that people know what we're doing at North Dakota Parks and Rec. Okay, going back online.
Joe Bowen, Grand Forks Herald. My understanding is that workers can't continue to collect unemployment benefits if their employer makes an offer for them to come back to work. However, many businesses are giving people the option to return to work if they feel comfortable. Is there a functional difference between those two scenarios? And if someone's employer gives them the option to return, can that person continue to collect unemployment?
Excellent question with a lot of nuance. And if I were an employment lawyer, I probably would still give a qualified answer. So I would say that's probably a good question for our unemployment insurance team. I think that because it's the depth of the question is on the nuance, because if you have an opportunity to go to work and your employer wants you back, and you decline that, then the way the rules are written, you're not eligible for unemployment at that point because you've had a chance to go to work and you didn't take it. So I know that part is very clear, but in the middle of that question, there was a nuance about if the employer is giving you a choice on whether you come back or not. So I don't know if that would qualify as an actual offer to come back or not. That's where we'd have to get real clear on what it is. But I think, again, we would ask both individuals and employers to understand that this is if you've and from a principled standpoint, from an ethics standpoint, people shouldn't be double dipping. You shouldn't have a job and be drawing unemployment insurance. And if you have a job and are able to work, then we would hope that the majority of North Dakotans who understand the value and the joy of work would work, and again help preserve the dollars for those that truly don't have an opportunity to work, because that's meant to be a backstop system. It's not getting an unemployment check's not a replacement for the value of actually working. Jeremy?
So today the State Board of Higher Ed and the university system started moving forward on reopening campuses this fall. I'm just wondering what your thoughts are on that decision and if you think they acted at the right time.
Yeah, I had a nice conversation, or a productive conversation, with the Chancellor Hageroth and Chairman Hacker from the State Board of Higher Education the other night, along with some folks from the governor's office and Lieutenant Governor Brent Sanford, and we're in full support of their decision. If you are Purdue University, others around the nation had also this week indicated that they were going to be accepting applications for fall enrollment on campus. And this is the time when seniors are making decisions and people are deciding whether they're going to come back. And I think the right decision is to get out there and say, yes, we're going to be open and we're going to do it on campus. Between now and then, if the virus is still going, there may be changes that are made in terms of distancing and classroom spacing and, people that are on campus, but you could have people on campus doing a mix of online and in person while they're on the campus to maintain some of that spacing. So their business models will continue to change, but I think that again, given the population of the typical age of a college student is at less risk, I think it's a smart way to signal that we're going to try to figure out a way to add, at least at a minimum, a mix of in-person and online heading into next fall. And of course, that can all be subject to change. They thought they're going to do school for the whole year, and at spring break they had to say we're done because of the virus. If it comes back strong next winter, everybody, we might be back in the same boat where we are, but if we are, we won't be in the same boat because we've built a bigger, stronger boat with all the skills and tools and testing and contact tracing and quarantining that we have. So we were kind of in, we were like in a bad Indiana Jones movie. We're, on a log riding through some whitewater, and maybe next year if it come back, we'll be on a nice boat that we built that we can sail through the storm together better. Online. And then Dave, and then we're done. I keep thinking Mike's going to ask a question when he raised his hand, but I'm like, come on, give me a break, Mike. No. Okay, Danny, online.
Chris Larson, Flag Family Media. In a previous conference this week, you had mentioned guidelines for churches. Do you have any further guidance?
Don't have any further guidance. Churches were always able to be open. We deeply respect those that sought to protect their congregations by choosing to go to online or other methods of serving the spiritual needs of their congregation as some may choose to voluntarily reopen this weekend. Some may choose to keep going with the online. If they do open, we would hope that they would follow the guidelines that we talked about for under all businesses, because all businesses, meaning all industries, including nonprofits, which is again, the list that we had up, the nine lists that are on the guidelines, they're part of the executive order, but we would certainly encourage all churches to follow those. It would be close every other pew, families can sit together, but strangers not, eliminate the passing of the physical offering plates that people might be touching a common surface, maybe having people, door greeters that are actually opening doors so the congregation don't all have to touch the same door handle, encouraging people that are vulnerable under either age or underlying health to attend virtually as opposed to in person. So a lot of common sense COVID etiquette rules, and I think that we'll see some churches reopen in a smart way. Others may choose to just stay online. We'll see. Dave?
I'm just curious, as we're heading into what is normally a big travel season, have you thought any more about the travel restrictions that you have for people coming back to North Dakota or flying back or driving back?
Well, we're keeping for now, the travel restrictions, if you're flying back from those hotspot areas, those remain in place. We did have a discussion today as other South Dakota always remained open. They did not have a shelter in place, stay at home. Again, we're fortunate Montana and Wyoming are among the states of among the four that have lower positive rates than we do. So we've got a great neighborhood here to speak of. And I think, Minnesota is starting to loosen up a few things. There may be a possibility that you might see a regional lifting where we might say that if you're coming from the neighboring states or parts of neighboring states, because you could even say, have different rules. If somebody's, been in an adjacent county versus if you're down in the Twin Cities, for example, we could think about those differently. But we want to, just think about how do we start making it easy for people to move within our region. The virus doesn't understand the state borders, and so we have to always take that in mind. But again, for right now, if people are returning from these hotspot areas, New York, Michigan, Louisiana, those other states, the 14-day self-isolation, check in on the North Dakota Health website when you return to North Dakota, and be North Dakota smart. So with that, we'll again say thank you all for being here. We'll see you tomorrow at 3:30. Appreciate all the questions. Appreciate everybody tuning in. It's a beautiful day in North Dakota, and it's free and it's available, and it's right now. It's called the outdoors. So get out, go for a walk, enjoy our beautiful state, and have a little bit of wonder about the amazing nature that we're surrounded by. Thank you, North Dakota.
This is a KX News special report.